Hi, everybody. I am really excited to be hosting this episode of Groundwork TV, and we've got a really important conversation ahead of us. And you'll probably be seeing a little bit more of me over the next stretch as we dive into a government shutdown and what it means for local communities across the country, but particularly for places that groundwork communities are doing their work all over the country. For those of you who don't know, I'm Joe, the founder of Groundwork Project, and I'm here with Valeria from the West Virginia Tenants Rights Project, which is a member of the Groundwork Organizing Network. Which I'm so excited to that you're going to learn a little bit more about it directly from Valeria. So I want to turn it over to you, Valeria. Before we get into the details of a shutdown, just take us back a little bit to what the Tenants Rights Project is and give some folks some information about you. Introduce yourself and tell us what you're up to.
Hello, it's so good to see you today, Joe. My name is Valeria Steele, and I am a resident of Princeton, West Virginia. It's in the southern part of West Virginia. And I had never been into organizing I had advocated for my son. He has special needs. And so I'd learned how to advocate in that avenue. But in 2021, there was a private equity that purchased multiple properties in our county, in Mercer County. And it was mobile home communities. And the ensuing chaos of the poor management, the habitability standards being non-existent, the rate increases, the illegal lease agreements. I started to advocate to try to find solutions, try to find information, try to find, what our rights were. And I was lucky enough to come into contact with your organization and become one of your grantees. And it's been an amazing journey of good and bad, learning that I didn't really actually know how everything worked in this world. And in that journey, we have filed class action lawsuits and have received a mediation agreement for the communities. But it's kind of a hollow victory because we have to work harder to actually get laws changed or laws enforced or some standard that protects the actual people that are trying to live in the state from the different avenues of both private equity and just abusive landlords.
I don't think it's something that a whole lot of people give a lot of thought to the extent to which a lot of folks have rented a home or apartment at some point in their lives. You sign a lease, you pay rent, and that's pretty much it. Not realizing all of the details that go into that lease, and that lease is normally written by the landlord, not the tenant. And so entering into that contract, unless there's legislation there, protections at the state level to protect you, that contract is going to be written in every interest possible in favor of that landlord. And so when you sign that document, you're signing a contract that literally they wrote and said, take it or leave it, which creates this massive power imbalance dynamic that's why you need tenant organizers and tenant organizations that can come together and concentrate that power to push back, to demand some basic treatment and basic dignity there. Because otherwise, the exploitation is can be horrific. And I want to kind of dive into that now with you, Valeria. Tell us a little bit about what's going on in a shutdown and what you're seeing and hearing from folks on the ground.
The biggest problem with the shutdown is the misinformation and the inaccurate information that is surrounding it. That's already been a problem up to this point. That I've learned by I have to talk to so many different tenants about situations. And I generally am interested because I want to learn. If somebody has information that is different from what I knew, that maybe it would change my opinion and make me better able to make better decisions. And so when I talk to individuals about, why would you support some of the, this administration, some of the things that they're doing that are so negatively impacting our area. And so many people are actually unaware of any of the policies. They're unaware of anything that it represents to the state. And when you get into longer conversations with people and you actually find out that it's not really about a party, it's not about politics, it's this cult of personality that has been created, that it resonates with the individual, whether it's a religious aspect or a cultural aspect or a racial aspect. And that's what they're supporting, not actually what they're doing in office. And that's very scary.
So walk me through that a little bit, because you're talking about misinformation, disinformation, and we've seen that writ large across social media by administration, by supporters of this administration, by people inside and outside government, but to push a narrative around the shutdown one, but around plenty of other things too. I mean, the narrative here that Democrats shut down government to make sure undocumented immigrants don't have health care. They don't qualify for health insurance, subsidized health insurance anyway, right? That's already the law. So like the entire thing that is being pushed forward here is already a lie, right?
Exactly.
Like walk us through it. Are you seeing that narrative actually swaying people? Is that, do they accept that as now truth, and that's actually what Democrats are fighting for? What are you seeing from the folks that, when you're going out to the engaging with some of your members, that recognize the value of the work that you're doing, but are they buying into the narrative coming out of being put forth by some of those influencers?
Unfortunately, some of the people that are more staunchly supportive of this MAGA movement, they are still seeing it as this, it's the Democrats, they're bad. But other people, especially a lot of younger people, actually are like, this isn't right. This is not making any sense. They're actually starting to see more people come forward and seeing, more documentation of like, it's a lie, covering a lie. That this is all just misinformation. And then I'll be honest, a lot of people they're seeing the economy is getting worse. None of the promises that were made are being kept. And so people are starting to have buyer's remorse. Like, I think we got taken for advantage of. And so it's about a 50-50 split. But the thing that concerns me the most is it's bad enough when it's a news outlet that's just being reckless and doing this for whatever their agenda. It's really disturbing when you see representatives of Congress. It really disturbs me when I see that you're blatantly lying. That's the only way to put it. And that, I think, may come back to bite them at some point when people do realize that, well, you completely lied. But I'm not sure how to counteract all of that because I'm more concerned with trying to get the correct information to people. And that's a really hard thing to do when there's been so much misinformation over a long period of time.
Totally agree with you on that. And I want to dive down into that because I think, some of the work that we're trying to support at Groundwork recognizes that across the country at the moment, there's a distrust of almost anything big, right? And you're seeing this media landscape get fractured. People are getting the news that you're getting every day is probably different than the news that I'm getting every day, based upon what some algorithm is sending stuff to my phone or your phone or somebody else's, right? But that's where there is a particular power in what's local, right? Because it's harder to completely discount the neighbor that you're seeing every day, the place where your kid's school, your place of work, business, the spaces that allow community to come together and interact and engage with each other. So I want to kind of dive into that and focus specifically on Appalachia and West Virginia. Shutdown's going to have an even greater impact on the region, specifically for rural and local communities. What does that look like where you guys are in Princeton, West Virginia, and the surrounding areas? And how is your housing justice work and the tenants that you organize going to be impacted?
What's so bad is where the economy is so poor in West Virginia and Southwest Virginia, it's even more poor because we're more. All of the things that have already been impacted, the highest employer, the most substantial employer in West Virginia is government jobs. That's already been cut by Doge cuts and them gutting agencies. And that, unfortunately, is jobs that are usually long-standing jobs. People have had those jobs for a long period of time, and they have benefits. So you have people that have lost jobs and benefits. Secondary employer in West Virginia is healthcare. Healthcare has been under siege for the past couple of years because of the first provisions in 2017 Tax Act, where there have been a lot of increases in coverage. A lot of rural hospitals have lost a lot of funding. They've had to cut back on staff. So you have people that are hit by more than one scenario. People are actually losing their employment, and then there are actually people that are employed in these situations that have one of these types of insurance that is on the chopping block to be cut with Medicaid expansion. Because you look at West Virginia, we have a high disabled population, an elderly population. And what's funny, or not funny, ironic, is we actually have the lowest immigrant population, the lowest trans population. So people that are on the soapbox about those issues were not affected here. It's a very minimal things. But the populations that are affected, with the elderly and the disabled and the low income, all of the provisions that are in the One Big Beautiful Bill will adversely affect West Virginia and every source of our economy. The third employer in West Virginia is retail. So you'll have people in retail that not only is their job being affected because stores are starting to feel the effects of inflation, and stores are, just last week, Kroger announced they're going to close hundreds of stores nationwide. So these are low income people that rely on some of these safety nets that are slowly being taken away. How are they going to have childcare? Are they still going to fund Head Start so that people can actually work? These are people that are working people that are on a form of the ACA subsidy. Is that going to be taken away? So then how are they supposed to afford a higher type of insurance or go without? How is that going to be healthy? How is that going to go moving forward? And so you've got this whole, if they go through with everything that they're planning to go through, it will be like a mini recession in West Virginia, because every avenue of our economy is tied to things that are being cut out of the economy in the One Big Beautiful Bill.
And the hard part that I don't think people wholly understand about healthcare is, the Democrats are trying to make sure these healthcare subsidies, tax credits, get extended, which is, ironically enough, a huge gift to a Trump administration, because without the extension of these tax credits, healthcare costs for millions of people are going to go up by a factor of 2, 3, 4, 5x, right? So you're going to be going from paying a couple $1,000s a year for some of these folks to $10,000, $15,000 a year for healthcare per person. So massive increases. The challenge, of course, is that if you're young and healthy and all of a sudden you got to pay a lot more for healthcare, what do? You don't pay it off. So it means, well, who stays on? The people that need access to care, but it means healthy people drop out of that insurance pool. People that need healthcare stay. Your costs go up even more.
And that's what actually happened.
Spirals, right?
That's what actually happened when he removed the mandate that you had to retain insurance.
Right.
So you had 13 million more people who chose not to have insurance, and so that drove up all the people that were using the actual emergency room for their health care. And what people don't understand is when they'll say that illegal immigrants are receiving Medicaid. No, they're not. They're entitled to EMTALA. EMTALA is stabilization through the ER. But people use that when they have no insurance I worked in the ER, and I can tell you that's how this works. And so when you have all these millions of people that are like, oh, I'm not going to get insurance because I don't want to, I'm not going to be penalized on my taxes anymore. And then you have this huge influx of people going to the emergency room. So not only does it raise the rate of the reimbursement for the actual cost for people to use the emergency room, but the EMTALA is a non-funded mandate. So they have to pull the money from all these other different sources. So it affects Medicare. It affects every government agency because they have to pull money from everywhere to try to come up with it.
I'm sorry. Go ahead. Keep going.
And what's so bad is, like I said, I've worked in healthcare for years, and the biggest boost to healthcare was Obamacare, because not only did it provide insurance, but they put in subsidies and additional funding so that if you were accepting this where it was like a little bit less reimbursement than some higher levels of insurance, it is what funded all of these rural clinics. It is what funded women's health clinics. I personally have run the women's health clinics so that people could travel to the hospital and get free breast cancer screenings. It put more nurses in schools so that they could monitor, illness and to keep the children healthy in the schools. It was the biggest increase in wages for hospital workers, the biggest increase in staff, the biggest increase in trying to have better cancer care, better ancillary clinics, and all that. He's trying to take all that away.
So it always struck me about healthcare. So I served on the health committee when I was in Congress, and somebody told me there was actually a part of taxpayer dollars that went to pay for, they call it a bad debt fund, bad debt for hospitals. And I said, well, what's that? And they said, well, people that show up in an emergency room, you're walking across the street, you get hit by a bus, scoop you up, put you in an ambulance, take you to the emergency room. You don't have insurance, it's going to cost you $50,000. Hospitals take care of people because they have to. It's the right thing to do, of course. But it means that the hospital then has this huge bill. And if a lot of folks don't have insurance, they have these huge bills and they can't cover it. So who pays for it? We do. Like taxpayers do. And then the federal government goes and pays some of that bad debt to hospitals to make sure that they don't crater and that they are able to keep treating people. So the idea behind Obamacare was this whole thing of, hey, healthcare is one of these systems that you don't really use until you need it. But when you need it, it's expensive. And at some point, everybody's going to need it, right? Everybody. You get sick, you have a baby, parents get sick, something happens. And when that happens, it's going to be super expensive. So given that it's super expensive, we want to try to get people treated earlier so it doesn't become so expensive. So that's all the things that you just talked about. But all of that is actually in the interest of trying to keep costs down, not trying to have them go up. It's not
exactly.
You're not trying to say, hey, we're doing this because it's a whole bunch of programs here that we want to give somebody. You're doing this to make sure that you are able to avail yourselves of the programs that you need in order to stay healthy so that you don't spend more money when you get sick and you can go back to work and you can care for your family and you can keep doing what it is you need to do rather than staying in the hospital forever. So I didn't expect us to get down to kind of public health financing here, but I am so grateful for the conversation. I want to be respectful of your time, but I do want to give you the last word here. What should people know about what's coming with the shutdown, with the folks that you are fighting for and working with in your community in West Virginia and across Appalachia? What's a takeaway you want to leave them with?
My biggest concern is where it has gotten to be that it's not about, and this current administration, it's really not about finding the solution. They tend to want to be, let's find someone to take vengeance upon. Let's find someone to blame and hurt them. And so the comment was made by the administration that they were going to take advantage of this shutdown for Russell Voigt to look at programs that they liked, that they could cut even more. And so my concern is that there are 9 states that have trigger bills. West Virginia has one that is inactive. There are 3 states that have review bills, so that if during the shutdown that they adjust the federal reimbursement rate, or a couple of the states, actually, it would be possibly even the federal poverty guidelines, then it would automatically trigger these trigger bells. And so the people that are on Medicaid expansion would immediately lose their insurance. And we're talking 65,000 or more in West Virginia, and across the country, millions. And what's so sad are some of these people are actually unaware that that's what their insurance is. They're like, I work at Walmart, but I was given this thing through the DHS, and I filled it out, and I get insurance for $30 a month. And they don't realize that's Medicaid expansion. That's what you have. And the only reason it's $30 a month is because these ACA credits are in place. And so not only would they would not be eligible, period, because it would change the criteria. And so they would lose their insurance. And that wouldn't be something that would roll out with the one big, beautiful bill timeline. It would be within a month or two. And that would be the worst case scenario here, because it would affect the low income working people here. It would affect the people that are respite care for the disabled, like the IDD waiver, the aged and disabled waiver, that work through these agencies that get these forms of this insurance to keep these to have these jobs to take care of these individuals. And so what would those people do? How bad would that affect the economy? And it would be immediate.
Yep. Thank you for taking some time to share this with us. Thank you for being such a strong advocate for people, not only in Princeton and Appalachia and or in West Virginia, but for all of us, because as you just said, those impacts are going to be potentially devastating for people all over the country. We're so grateful to you.
And you gave me this opportunity, so I'm forever grateful to you.
Please.
And the best thing that I can say is that we need to unify. Because
Amen.
The whole thing is that we find a way that people have their power, and that people are in charge of the things that are going to enrich their lives and make their lives better. And so that's what I'm pushing for, is we're trying to get this. Let's unify, and let's come up with ideas that will help give people power to help fix their solutions, to find their solutions.
Amen.